Good evening, everyone. I'm Dawn Kleindorfer, and I'm the chair of the Department of Neurology here at the University of Michigan, and welcome to this inaugural ceremony. We're really excited that you're all here today. We're going to be celebrating the Andrea and Lawrence A. Wolfe Research Professorship and the installation of Dr. Melissa Elafros as its inaugural holder.
I think that what the Michigan medical system, medicine does is totally amazing. And when we talk about research because we believe that you have to support research. You don't always win, but if you don't try, you never win. So we believe in research. And then we believe in Eva. And Eva said, I want you to meet some people. And we met this adorable little girl who's having a baby.
I'm glad she said that, not me.
Melissa is like, she has drive. She has this amazing drive, and she just convinced me just by talking that this was a person I wanted to support, and Larry said, whatever you say, dear.
Right.
We both believe that the brain is the key to everything. I'm big on inflammation. The brain is all about inflammation. Melissa does research in Zambia and in Flint and underserved communities, and all of this she ties together, and she's going to make some huge strides, and I'm very proud that we can be a part of this. We will always support Michigan medicine. We think what goes on is life-changing.
So, philanthropy and Larry and Andy Wolfe are becoming somewhat synonymous words here at Michigan Medicine. And I always think you can maybe say it's in Andy's DNA because, there is, of course, the D, Dan, and Betty Kahn Foundation that has been enormously supportive of Michigan under Larry's direction, with Andy being the cheerleader in the background. We're sitting in the Kahn Auditorium, and if you go outside, you can look across and take a look at the new Kahn Health Pavilion. It was through another Kahn Foundation event that I first really got to know Andy and Larry. It was 2011. The Kahn Foundation supported the formation of what's known as the Michigan-Israel Partnership under David Pinsky's leadership. And then in 2012, they took 20 University of Michigan scientists and they brought us to Haifa. And it was really amazing. And day one, we're sitting in really a fantastic scientific symposium. And there's this woman in the front row, madly taking notes, asking these really great questions. So I turned over to David Pinsky and I said, did you hire a scientist I don't know about? Who is this person? Well, it was Andy. And that really is the beginning of, I would have to say, a couple of things. One, a fast friendship, and two, my understanding of what a remarkable, actually, scientist Andy is. So I have to tell you, to say that Andy has an interest in science or a passion is really an understatement. And we've had the pleasure for actually coming and visiting us in the lab. She has her own lab coat. We put her to work. We glove her up and we put her to work. And she actually has worked in the laboratory. And when she comes and visits us, it's infectious. Her enthusiasm and her love for science are truly infectious. Now, one of Andy and Larry's particular interests, as you heard, and mine, is on brain health. And with their support, we formed the Andy and Larry Wolfe Wellness Initiative for Brain Health and the Neural Network for Emerging Therapies. And in less than 2 years, because of their generous support, we've been able to publish over 20 papers that have helped us understand the following. And it's how what you put in your mouth, what you eat, what you're going to have at that reception actually affects the immune cells in the brain that help shape the neurons that allow you to think correctly. What's really even more dear to me is this personal friendship that we've had over the years. Larry and Andy are my dear friends, and it's their passion, their caring, their generosity that knows no bounds, and brings us to today to celebrate Melissa, Dr. Melissa Elafros. So I first met Melissa in 2019. Dr. Brian Callahan, who I've had the pleasure of being a mentor to, introduced me to Melissa and said, we need to bring her here. And after 5 minutes, I thought, we really need to bring her here to the University of Michigan. And we were successful in doing that. She was our fellow, and then she came and joined our clinical group, which is shown in the upper right-hand corner. And then, of course, very fortunate to us at the Neural Network that she also joined our research group. Brian, in the academic world, you have pedigrees. And so Brian is my academic son. So needless to say, Melissa is my academic granddaughter. Now, my academic granddaughter is a phenom, okay? She is doing this amazing research in Flint, Michigan, which she will tell you about, coupled with research in Zambia. So it's really, in my mind, what she has been able to accomplish in a short amount of time, somewhat breathtaking, and you'll hear about it. So it's really with my greatest pleasure that I was able to tell you a little bit about Andy and Larry, and also about their amazing young new professor, Dr. Elafros. Thank you so much.
So Andy, Larry, it's been an absolute pleasure to start to get to know you. And when we first went to dinner, we initially talked about that everyone has a bit of a different path. And we talked about my path. And I hope that the next 20 or so minutes will kind of expand on that and show you a bit more about my values and the people that help form those values and how that informs the work that I do. And looking back on my childhood, which I feel like I'm doing more now that I have children of my own, it occurs to me that what my parents tried so hard to do was raise independent women, which basically translated to that they kept throwing challenges at us. My mom was an occupational therapist and worked in the public schools, so she made sure that we were pushed academically. And then my dad did everything else. So I can't tell you how many sprinkler heads or toilet handles or car parts that I changed before I was 16, courtesy of my father. And so my biggest challenge growing up was beating my sister Allison. Allison was 3 years older than me. She's brilliant. So what I tried to do is do everything that she did, either better or earlier. So I showed up at 18 and I left at 30 from Michigan State. I graduated. I did graduate a couple times. But it was a good fit. And there are really two reasons why Michigan State was such a good fit for me. And the first is that I met this man welcome week of undergrad. It was probably not the best start to a relationship, but we started dating in 2007 and got married in 2019. So you can take a minute and do the math if you'd like, but it was 12 years of dating. But anyone that knows Jackson will tell you about his dedication and his determination. And that really, I think, shines through these 12 years of dating. When we got married, I also fortunately inherited his parents. And it was very clear early on where his dedication came from. And then as Eva said, there's not a presentation that's not complete without Nate. So as she said, he turned 2. He has a bike now, and we've got him off his bike so he can be here today, but he's not thrilled about it. We've learned that he has Jackson's determination and my passion, so it's going to be interesting raising this kid. And we're having another son who is hopefully nicer to his older sibling than I was to mine. We'll see. The other reason that Michigan State was the absolute perfect fit for me was this woman right here. And so that's Gretchen Burbeck. Gretchen is a neurologist by training, but to those of us in neurology, she legitimized the field of global neurology and made it so it was more than a hobby, that it could be a career. So at the end of my undergrad, I walked into her office and said, I want to do an MD PhD, I want to do it internationally. You're the only person in epidemiology doing it. Will you help me? I wasn't important enough to do that. I didn't really know what I was asking, but she took a chance on me. And I'm so grateful because through that, she's taught me so much and taught me that while I wanted to do something important really translates to impacting patients and population health. So she first sent me to the hospital in your upper left corner, which is a small rural mission hospital in the middle of Zambia. And I became a neurologist because of the time that I spent at Chikinkata Salvation Hospital. My first week there, I watched an 8-year-old boy die of tetanus, probably tetanus. There wasn't a ventilator, there was nothing we could really do. And that's really what taught me that it was important to impact patient care. Because to me, it was unacceptable that an 8-year-old would die because his mom was 6 months late on his vaccines. And so I then transitioned to working at the primary tertiary care hospital, which is the university teaching hospital there. And at the time that I first started working there, the only neurologists were predominantly researchers. And then there became a couple others. And I chose to do a fellowship in neuromuscular because of my time there. And while there, we diagnosed someone who was about 4 years older than me with ALS. And to watch that, he had the best social support in the world that I've ever seen. But to watch that unfold in a setting where you can't give the advice that we would give here, and you can't offer what little I feel like we can offer here was really hard. But those experiences really transformed what I wanted to do with my life and why I decided to commit myself to working in resource-limited settings and with populations that don't have everything that we have at the University of Michigan. So Jackson and I never figured we'd come back to Michigan. As you can see, all of these mentors are on the East Coast or farther east, so we figured we would stay that direction. But when we were talking about what we wanted out of our careers, we wanted strong mentorship, we wanted someplace where we could be near family, and that we would have support for family. And as Eva mentioned, that's when I met Brian Callahan at a conference. And so Brian he's fantastic because he does a very good job of valuing family as well as work. But he did a great job of introducing me to Eva, and then also Leslie Skolaris. And Leslie is a stroke physician who's worked in Flint for as far back as I think any of us can remember. And she took me under her wing along with Brian and helped me kind of transition my work to do what I value in Flint at a time when it was hard to go back over to Zambia. So to talk a bit about the work that I'm doing, so there are really two main areas that I've got things going. So the first is the Flint neuropathy study, which is in Flint, Michigan. And so the reason that we decided to start this work was that we have a pretty good understanding of what the prevalence of neuropathy and the risk factors for neuropathy are in Europe, in places like Europe, but we don't know what's going on in the ground in what I like to call kind of the real world, places like Flint. So to do this work, we went to Hurley Medical Center and we drew on some connections that I had from Michigan State and have paired up with their primary care clinic where we are looking at neuropathy and neuropathy risk factors in their patients. And the clinic population is predominantly low-income African American. So let me tell you what we learned. So the accepted prevalence for neuropathies in the US is 13%. So that small red piece of the pie. In our population, it's actually 73%. It's a huge difference. And of those patients, 75 of them are a brand new diagnosis based on the research study. So most of the patients that have neuropathy don't know they have it, which is a huge problem because neuropathy, we know, causes damage to nerves, which can then lead to infection, amputations. And the same nerves that go to your arms and your legs also go to your heart and your lungs, so people with neuropathy tend to die earlier than those that don't. So for those that are not in the medical field, I wanted to just show you a quote from one of our patients so you can kind of understand what these feel like. So a 54-year-old woman said to us, it was in my big toe, and it would go numb with a bunch of tingling, and it felt like if I could just cut that toe off, I'd be okay. Within the last 6 months now, it's in my hands and has climbed up my legs. It's the sleepy feeling, little knives, and then every once in a while I get a heartbeat, a throbbing. It'll wake me up in the middle of the night and I will get up and I'll walk it off. It doesn't take it away. It just makes me feel like I'm doing something and shuts my brain down to where I can lay back down and go to sleep. And she had had these symptoms for quite some time and had talked to her doctor about them, but didn't know what they were. So we are now asking the patients, what their experiences are when they bring these things up to their doctor, why they could potentially have them, and are trying to work through kind of the patient's understanding of neuropathy symptoms. I did eventually make it back to Zambia. So the work that I have going on there is the cohort of healthy aging and dementia. So this is a study where we have community healthcare workers going door to door in the capital city to see what neurologic risk factors there are. And they're knocking on doors for us to find people that are 55 and above. So we're screening people for blood pressure, diabetes, we're doing body measurements to figure out obesity, but as well as malnutrition. And then they're administering a screen for cognitive impairment. After that, we're inviting people into the clinic where the doctors are doing neurologic exams. So you can see this is Dr. Namwangala, who is testing for neuropathy right now with a pin. And then they get formal neurocognitive testing where using instruments that have been validated in this setting. And we're learning a lot. Generally, as a population, Zambians are quite young. About 50% are below the age of 18. But they're aging quickly, and a lot of the risk factors that we associate with medical conditions here are popping up over there. So we're starting to see things that we may not have seen 20 years ago. And I do, forgive me for reading to you again, but I've got one quote that I want to show you from a caregiver of a patient that I think really kind of tells the story of the experiences that they're having. So this is the daughter of someone, and she says, sometimes when I sleep, my mother, fails to sleep. So some of her grandchildren who don't know her very well have started calling her a witch because she doesn't sleep. Even community members have started calling her a witch, especially because sometimes she leaves home without a shirt. So people now in the compound say, witch, witch. I worry that she gets confused. She gets whatever it's at hand, such as a metal bar, and hits someone like the kids at home. I worry that one day my mother will kill someone. I become worried that when I go far, she'll wander off. I become worried that maybe she will go out without clothes, and people may stone her because she's a witch. So I'm always with her. And this daughter didn't know that her mother had dementia, and that's why this was going on. So we've been linking these patients to care. So to conclude, I want to take a step back and address kind of the question that always lingers in the air of, why do I live in Ann Arbor, work an hour north, and then across the Atlantic? And as we said at the beginning, that my values are that I wanted to do something important, and that to me, that became impacting individual health, population health, and kind of transforming communities. And in each of these settings in Flint and in Zambia, I think we can all agree that we're certainly impacting patient health, and that this work has the opportunity to build capacity and transform care in those settings. I think the part that's often overlooked is that by working in these settings, we have the opportunity to better understand the challenges that are everywhere. So I don't have extra money. If I had extra money, I would probably bet that the challenges we're seeing in Flint with undiagnosed neuropathy are prevalent in Ann Arbor and other parts of Michigan. And we're working to do that study in order to get that answer. But you don't have a complete picture of the problem if you're not looking at all the places the problem is. And then lastly, now that I have kids, it's certainly important to me that the way that I live my life is the way that they're going to live theirs. So part of this is that by doing this work, I'm showing Nate that, and the next son, that he too can be significant. So again, Larry and Andy, thank you so much for the support. I'm very grateful.